Fighting cancer is like a long, tiring marathon. You don't know where your finishing line is. But today, I, Renu Singh, am proud to say that I am a cancer survivor. I still remember the day 20th November 2019, I was diagnosed with breast cancer. Then my gynecologist, Dr. Neelam Suri at Apollo Indraprastha, Jasola Vihar, put me together. She counseled me and said, Renu is just a cancer, not a death sentence. Then she introduced me to the oncologist, Dr. Siddharth Sahni. I still remember he spent nearly 1.5 hours examining, counseling. Dr. Siddharth Sahni introduced me to radiologist Dr. Khosa and his team for the next step in my treatment. Dr. Khosa too very patiently make me understand the next process of radiation, its side effects, whole process of radiation. And today, after 6 months of treatment, I am here to say that I am cancer free and a cancer survivor. At Apollo, they were always there for me. They treat you not as a patient, but as the family. They were always there for me.
I'm Dr. Neelam Suri, Senior Consultant, Gynecologist and Obstetrician in Indraprastha Apollo Hospital, Sarita Vihar, New Delhi. I still remember Mrs. Renu Singh coming to my OPD for a gynecological problem, and then she used to come for her follow-up gynecological examination every 3 months or 6 months to me. In course of my routine checkup, I found a small breast lump, and for that I sent her for a biopsy and radiological examination. During the course of this testing, she was found to have malignancy in the breast. And then I counseled her at length that this is not the end of life. She was completely devastated when she was with me in the OPD. And then I counseled her for a long time, and then I introduced her to the oncosurgeon, and she took the treatment, and now today she is doing so well.
Namaste, I am Dr. Siddharth Sahni. I am a senior consultant breast cancer surgeon at Indraprastha Apollo Hospital, and this is to give you a message of how early detection can actually lead to cure of breast cancer, in particularly this patient, where a small surgery to just remove the lump and one lymph node was done, and followed by the standard radiation protocol, and then there was no need for chemotherapy. The chemotherapy is essentially decided on the type as well as the stage of the disease, but this patient had both favorable type as well as stage. But if you do go and get a mammogram done once a year, it will save you a lot of headaches in terms of the amount of treatment required as well as the cost of the treatment. Also, please take out the time once a month to examine your breast, just to tell your brain what normal feels like. For women who are having periods, it's day 10 of the cycle, day 1 being the day the period starts. And for women who've stopped their periods or who don't have it, any day in the month. Please do it. It will save your lives. Thank you and namaskar.
Namaskar. Myself Dr. Khosa. I am a consultant radiation oncologist at Indraprastha Apollo Hospital, New Delhi. This is one of my patient, Renu Singh. She is diagnosed with breast cancer. Nowadays, I tell her, Renu, nothing to worry. It's a pretty simple procedure. Coming on to the breast cancers are becoming very, very common nowadays. Left-sided breast cancers are a challenge now. Why? The heart lies under your chest area. So it's very, very important that we avoid any extra radiation doses to the heart. So I suggest everybody, please don't fear radiation. It's a very, very effective treatment modality and helps improving your outcomes. and surviving long with cancers. We are following all the WHO standard guidelines of social distancing, sanitization, fumigation, so that nobody transmits COVID to one another in the premises and everybody is safe. Thank you.